Hello and welcome to the fifth lesson, the fifth day in this introductory series to the Feldenkrais Method of Somatic Education. The channel name is Feldenkrais with Alfons and I am Alfons. If you came to this video because of its title or you have a problem, you're looking for a solution, today we will work with the hand, the tension in the hand and the habitual tension, some kind of chronic tension we are not aware of but it's always there. And this kind of chronic too much tension in the hand can affect not only the hand or the wrist, painful in this area, but it can be painful up the arm, it can be painful in the side of the neck of the hand. It can even restrict the breathing or contract the whole spine and lead to all sorts of problems. So we will work with that and probably be able to resolve quite a bit of it. On the other side, if you are a Feldenkrais practitioner or into somatic education, or you are an educator, a yoga teacher, somebody who's interested in the mind-body connection and so forth, this is a very special video because today we go a little bit deeper than usual and we might touch on the very soul, the essence of the Feldenkrais method. We won't walk straight into it, but maybe just touch on it, and I think this can be quite a special moment today. Also today we have quite a schedule, so in the beginning I will teach a little bit of anatomy. I have a very pretty fancy software and I will walk you through a couple of things in the software. 7 minutes will be entertaining and not very difficult to follow, more on the easy side. If you're watching this video in your chair and you're actually not participating, actually you can participate. All you have to do is to get your armrest ready or a table where you can put your elbow. You can participate and watch. Alright, so let's get into it, let's get this video started. So what you see here is a look into my anatomy software. This one is called Essential Anatomy from 3D for Medical. It's quite inexpensive. If you're looking for a free version, there's also Essential Skeleton. I highly recommend you download it. It's available for macOS, iOS and Android devices. So let's have a look at the skeleton. You can see it's a pile of bones, nicely matched together by the computer because there's no gravity in the computer, and we will look at the arm and the hand because we're going to work today with the arm and the hand. So you can see here's the upper arm bone and here's the lower arm bones and here's the hand. The good thing about the computer is we can just click on it and the computer will tell us the name. For example, I right now clicked on the ulna. This is one of the two bones inside the lower arm. I want to point out one feature, so it's something you can think about because the two bones obviously similar looking, but if you look closely, this ulna, which is the bone which is further away from the thumb, this bone is bigger at the elbow and smaller at the wrist joint. Can you see that? At the elbow joint it's bigger and at the wrist joint it's smaller. So when you lean against your elbow on the table, for example, you're leaning against this big part of the ulnar bone. And the other bone, the radius, is smaller at the elbow joint and bigger at the wrist joint. I'm pointing that out because that's actually something you can feel when you touch your arm and your skin, and you can feel the underlying bone. For example, the humerus, your upper arm bone, has this spike here, this epicondyle. There's a medial and a lateral. So on both sides there's something spiky, and then there's another spiky thing which is your ulna from your lower arm. You can try to find that, try to feel out for that, to get a feeling of these bones and how they are inside of your body. Then we have a brief look at the bones in the hand. So you see in the hand there's a whole lot of bones, and you can see every finger has like 1, 2, 3, 4 bones except the thumb, which has only 3 bones, and then in the wrist there's 8 bones. We can zoom in here so you can see there's 8 bones in the wrist. This one is funny, huh? It's like a little pebble bone. And you can see it's not just bony material, but there's this very shiny surfaces, the cartilage surfaces, which form joint surfaces. So the bones, they don't rub against each other fiercely, but they have a nice sliding surface. Every area where they could touch each other is coated in this nice joint surface. However, there's more than bones to the lower arm. The human doesn't consist of bones alone. There's other structures, for example, the ligaments. To look at the ligaments, I have to use a different software. The software of my choice is called Complete Anatomy. It's from the same company. In this software, you see the skeleton model looks a little bit more realistic, a little bit more Halloween-like. But here we have this nice little button where I can add layers of connective tissue. So I add one layer, you can see there's little ligaments added. And when we zoom in here into the wrist, you can see there's ligaments added. This one, and there's a ligament here which connect the bones, bone to bone connection. And here we get a little disc. I think this is a nice little finding. We get a little disc inside here, so it avoids friction and it distributes forces. So let's add another layer of ligaments. You see, there's more ligaments added to it. Now we have here little ligaments. See, there's more coming. I can add another layer of ligaments holding the many bones together. So these are not muscles, these are like strong bands holding the small bones together. And another layer you can see here and here, for example, in your fingers, here's the knuckles. These are joint capsules. That's something you can already feel or palpate from the outside. And just add another layer and another layer, so you can see it's really like a bandage. Everything is packed into these ligaments. A view from the inside would be like this. You can see there's a whole lot of ligaments. Now it really looks like Halloween-like, doesn't it? Alright, we're back to essential anatomy. You can see it's not as detailed as in complete anatomy, but it will do. Let's just add some muscles. So this is one layer of muscles. You can see when you download this software, you can really explore for yourself and you can see where these muscles are connected and you can imagine what they will be able to do. And you can spin the skeleton around for yourself. And I just add another layer of muscles. You can see, and another layer of muscles. And this is very interesting. Here's this one is called the extensor indicis. This must be lifting your pointer finger. And you can see on the top end there's muscles. And then it starts to become a tendon. So there's the difference between tendon, which connects bones and muscles, and the ligaments, which connects bones to bones. And these tendons are quite interesting. You see, they run down to the finger and you can see where they actually attach. You can really spin the skeleton around. On the inside, you have the flexors of the fingers. This is like one muscle with 4 tendons, but of course we can control them all separately. Let's add another layer. You see, this starts to look like a hand.
and another layer and another layer. So you can see it's kind of fun to use anatomy software to get to know the body better from an external perspective. So this is not an internal sensation, you have to be very clear about this. It's like an external image, and now we will start to practice with the Feldenkrais method and try what can we feel about these structures, how can we use them, how do they play together.
So I hope that was interesting, a little look into the arm, a little look-see. And what I want to be very clear about is that this was not an internal view, but it was an external view. We opened the body with a computer model and we looked inside from the outside. And there's quite a big of a difference to look at something or to experience something from inside out. Now, without further ado, there was already a lot of ado, let's start with the main lesson. So please come to lie on the floor, on your back. This will be a slow lesson. If it's a little bit chilly chill in your room where you are, maybe you want to have a jacket or a pullover or a blanket, something to make yourself cozy, and when you start to calm down you will not feel cold. Just make sure you will be able to stay warm. So just getting nice and cozy. If you have pain in your hand, work with the hand where you have pain with, or the arm you have pain with. If you don't have any pain, work with your dominant hand, the hand you write with. If you're a Feldenkrais practitioner and already have done this lesson a couple of times with one hand, then do it on the other hand. You can do this video 2 times, one with the right arm, right hand, and one with the left one. I will introduce it to you with the right hand. So if you're doing it with the left one, you have to translate over to the left side for yourself. Should be easy. You can have your legs long, lying or standing. You can switch from standing to lying during the lesson just as you want. So let's start with the lesson. Please bring your lower arm to standing. Stand your hand, your right hand, in my case, over your right elbow. And find a good position to do that. A good position means it should be floating, the hand should be floating on top of the elbow. So there shouldn't be any wild angles, too much of an angle or too low. You can think of your lower arm like a candle or something, just something you would stand. So you're standing on the elbow, yes, and the hand is on top of the elbow. So if somebody would walk around you and look at your lower arm, it should be exactly upright, vertical. And then bring your focus onto your hand, obviously, and start to do something so that your hand can fall over towards the side of the palm. But it shouldn't fall, it should just sink. What can you do so that your wrist is bending and your hand is sinking over? And then bring your hand to stand again. Don't stretch out your fingers, but have your fingers fairly relaxed. Fingers fairly relaxed. And then again, let the hand just sink. In a way, do something so that the hand can fall over, but don't let it fall over. Be nice to your hand. Hand is so important. You experience the world not only through your eyes and the nose and the ears and so forth, but also through your hands, through touch. the hand is not only a tool, but it is maybe a tool, but continue with the movement. Try to find this very gentle way of letting the hand fall over in a controlled manner, in a loving manner. So you don't push it over, but just let it sink. So some people have very flexible wrists, super flexible, and they can have the hand fall in both directions. Backwards, which means towards the back of the hand, and forwards, which means towards the palm. But we're looking for the direction of the palm. Is it forwards or downwards? And do this many times, but it's not a gym workout. First of all, there's no weights, but we're not looking for many repetitions. We're just looking for a feeling. Put your elbow in a good position. You can put your elbow closer to you or further away. If you're sitting, I recommend to do this lesson lying down, but if you really don't want to lie down, if you just want to sit and watch, you can still do it by placing your elbows somewhere in a comfortable position and then let your hand sink. Sink. And when you remember the anatomy video, there's so many little it's 8 bones in the wrist. And they articulate with the radius and the ulna, the bones in the lower arm. And if you still have this image of the many bones in the hand, so all these bones and the tendons, the ligaments, the muscles, the skin, everything has to participate in this gentle falling over, sinking down. And the bones are moving against each other, sliding. Continue with that. So always try to be comfortable, always try to have a good feeling. If you don't have, then change the position slightly. It's always the same movement. Just bring the hand to stand again more and then start to have the hand fall, sink. Maybe you can feel something in your stomach, some feeling of relaxation, some sound, grumbling sound, peristaltic. And start to bring your attention to your fingers. How the fingers separate, or they slide against each other, or maybe the fingers are sticking together. Maybe it's just 2 or 3 fingers that stick together, and then some finger is obviously the thumb is separating from the other fingers. Just notice what your fingers are doing. It's like an observation. So it's a mix of an external observation. You look at your fingers from the outside, or you feel from the inside. And we're looking for this internal experience of how you organize the movement, and while you do the movement, you get feedback and quality feedback about what's happening in your hand while you're moving it. Then just let your hand hang. The next time it's hanging, just let it hang. And there's different directions the hand can hang, of course. Just find the most comfortable. So the hand is hanging, and start to move your thumb a little bit. So your attention moves towards your thumb, and see, you can lift the thumb and let go again. And lift the thumb and let go again. and then bring your attention to your index finger. It's the second one, and lift the index finger and then let the index finger sink again, and see that it's only a movement of the index finger. If that's possible, so you have to kind of inhibit the other ones, but then inhibition should be very early in the brain. You shouldn't force the other fingers to not move, but just focus on the index finger to move upwards, and then let it sink and have the whole hand relaxed, and then start the movement with the index finger again and then downwards again. Try this a couple of times, and there's many bones, isn't it? Aren't there many bones? There are many bones. Aren't there? I think that's the correct grammar. Thank you everybody who helps me with my grammar and articulation. Bring your attention to your middle finger and lift the middle finger and lower the middle finger. And you can see maybe it's more difficult than the index finger. Try that with your ring finger, which is the fourth one, and maybe this is the hardest to move only by itself. So don't wiggle the finger, but lift it in its segments and then let the finger sink again. So it's not wiggling, it's lifting and sinking. And then the pinky one, the fifth one, the small one. Lift the small finger and then let it sink again. And then I would say we take a short break. In the original lesson taught by Dr. Moshe Feldenkrais, he doesn't take any breaks during the whole lesson, I think, or maybe just like one or two, very, not many, but small breaks is okay. Then bring your hand to stand again on the elbow and try to sink the hand again. So did anything change in your perception? Because we have been working with the whole hand, sink the whole hand and then the fingers separately. So maybe bringing attention to your fingers separately already raised your awareness for the whole hand and what's happening in the whole hand during this movement. It's a very peculiar movement to get rid of habitual tension. So it's not stretching and it's not like tensing and relaxing, but it's through movement. Then just let your hand hang and rotate your lower arm so that your fingers point more towards your face, and then keep it rotating until the fingers point away from your face, more like downwards to your legs or maybe even outwards, and explore this rotation. So that's our next movement we are exploring. And you have seen in the anatomy part of this video these two bones, how they rotate. Maybe you can feel that. Maybe you can feel that in your wrist, how the bones in your wrist adjust to this movement. The fingers, maybe you can get some sensations from there. You can feel if it's smooth turning, or if you have like areas where it's more difficult, where it gets more stuck, or where it's more easy to turn it. At some point it stops. You can't turn any further. So what is stopping there? Can you feel that inside your arm? Your hand? At some point it's easy to rotate, and then at some point it's not anymore, and then it stops. And is it evenly spread out movements, or do you have like different stages? Like walking through a forest, it's not paved, but there's different qualities alongside the way. Then let's take a very short break Just bring the arm down again. See how that feels like. So if there was tension or some stress, we just break it. We just let go of it through a short rest, and then bring your lower arm to standing again. And turn your lower arm so that your fingers are pointing more towards the toes, or how far it goes, how far that's possible to turn the hand without straining, and then lift the hand and sink the hand again. And make it really slow. Try to make a slow movement. And the slower you move, the more you are able to experience or feel. And of course, it takes some practice to stay with it in your mind, to not make the mistake of starting to make blindly repetitions and think of something else. So I'm talking to always bring you back to this of bringing you back into your body. Whenever your mind wanders off, I'm talking to bring you back. Focus again on yourself, on the movement, on organizing the movement, and then let go of this movement and turn the hand towards your face, the furthest part towards your face, and do the same thing there. So it's turned, twisted, the lower arm is twisted in the other direction, and raise your hand and let it sink again, and be aware of what your fingers are doing. If they move separately now, or if some fingers feel like they're joined together. You can play with your fingers, of course. So these are guidelines, these are suggestions, very systematic way of going through movement, but you can always take the liberty to play a little bit and then come back to this very systematic way, because there's a lot of thinking behind it, lots of structure and theory. So play with it, but always come back to the structure of the lesson. And then rotate your lower arm again to see maybe something changed in this rotation. So your fingers are pointing inwards, upwards, downwards, maybe a little bit outwards. See if anything changed in this movement. And then take a short rest. Lie down your arm again. Rest your arm on the floor or in your lap when you're sitting. And then bring your lower arm to standing again, with your hand hanging. And now we go deeper. This is very interesting now. Start to lift your elbow a tiny little bit. Don't do it yet, just yet. Don't do it just yet. Just think of your elbow. And maybe think of like there's a little wind, an upwards breeze, like the lady in red. The lady in red. Some wind coming from below, lifting the elbow, and then bring the elbow down again. Make sure that your lower arm is upright. And start to lift your elbow just a little bit and then bring it down again. So you have a shoulder joint, and you lift the elbow. It might be easier when you leave the shoulder joint on the floor. If you think that the shoulder joint is going in the opposite direction of the elbow, might be easier. Or you lift both together. Play with this a little bit. How can you make it easier to lift the elbow up a little bit and then bring it back down again on the floor? You can always take a small rest and then start again. And when you do that, let's try to be aware of what's happening in your breathing. When you lift your elbow from the floor, don't hold your breath. Just continue breathing, just normal breathing. When you lift your elbow, don't clench your teeth. Make sure you have a relaxed jaw. Make sure you have like a relaxed nose, nostril, a relaxed face. This is very interesting now, isn't it? When you try to lift your elbow, try that the whole body is relaxed. The whole body is just lying. That you do not shorten the spine. And here we have the connection to the spine. When you lift your elbow with your hand relaxed and hanging, when you lift your elbow, the hand is relaxed and hanging in any direction it wants to hang, and you lift the elbow, and the spine does not contract. Try to keep the spine long. So it's from your pelvis up to your shoulder blades, to your neck. Everything, even your breathing, your eyes, your forehead, everything should be relaxed while you are floating up your elbow until you can straighten your arm. It's not like it's more like extending. It's not like really straighten it, but somehow more straight than bend. And also be aware of the pathway. Where do you lead your hand to? Do you lead the hand more over the midline, or do you lead your hand to stay outside next to your torso? How do you rotate your lower arm when you raise your lower arm? Rotation. Lifting without shortening, lifting without contracting, without holding your breath. Until you can say that you successfully lifted your elbow. We might take a second break, a second of a break. Just rest your arm, just a second. And now bring your lower arm to stand again, your hand to stand again, and start to lift your elbow again with the same quality we just found. Do it a couple of times, so it's just an easy lifting. Your head is hanging, your hand is relaxed and hanging. Until your elbow is fairly straight. So we had a break, but try to have the same quality. Don't go back to a forceful habit. Just float your elbow up. Don't clench your teeth, don't hold your breath. Try it many times to float your elbow up until the arm is fairly straight. And once the arm is fairly straight, move the hand a little bit upwards towards the face and then downwards towards the legs. So it's an up and down swinging motion. Dr. Moshe Feldenkrais calls it like a pendulum. A pendulum. Is it? But it's the wrong direction. It's more like a tree that's swaying in the wind. Keep your hand relaxed. Let your arm turn in whatever direction it wants to turn. Just up and down, and find like different positions for your arm, so you can find a fairly center position, so that the arm is standing more or less straight from an outside perspective. And then start to lift your shoulder blade in the same manner as you lifted your elbow before. So it's the shoulder blade, which is like a bone in the back. You can feel it maybe squeezed in between your torso and the floor, and start to lift your shoulder blade and come down again. And lift and let it fall or sink down again with the same quality, and be fairly relaxed in your arm and in your hand. And try to have this long, relaxed spine, a relaxed neck, a relaxed face. And once you have that, try to make it a little bit faster, so you can really have your arm fall backwards. It is backwards. Forwards is towards the ceiling, backwards is towards the floor. It's in your back. So you can let your arm fall backwards until you can feel where the arm hits the floor. Hits the floor. Make it faster. Ta-tam, ta-tam, ta-tam. Until you can feel at where is the point where your arm is leaning against. How is your arm standing? Your arm is actually standing on the floor. Do a little bit more of this swaying movement, just to find, so your arm up, arm down a little bit, arm to the left and to the right a little bit, just to find where is your arm standing on the floor, to get a better feeling for how your bones are stacked on top of each other in a relaxed fashion. And then bring your arm down again, or first bring your elbow down again, float your elbow down again, then lie down your arm on the floor next to you like a good friend, and take a short rest. Then we will float the arm up one more time, just to review this movement and the movement quality, most important of all. So please bring your hand to stand, your lower arm to stand again with your hand hanging. The hand is hanging. And then start to float up your elbow. 2 iterations, not everything at once, but float it up a little bit and then bring it down again. Float it up a little bit and then bring it down again, to start to be aware of the tension in your body. Maybe there's habitual tension pattern, some tension that just starts when you lift. But don't let that happen. Have your hand relaxed and your elbow starts to lift and back down again, and your neck is relaxed and your spine is long. Have a long feeling of the spine. Undisturbed breathing, and every time float the elbow up further, higher up. With every attempt, float the elbow higher up until the arm is fairly straight. And you can feel that your arm is standing on top of your shoulder blade. That's quite a strong feeling with me actually right now. I can really feel how the arm is standing, like a leg, as if my shoulder blade was a foot. Quite interesting. So we have this motion of the, Dr. Feldenkrais called it pendulum, but the swaying motion upwards and downwards of the arm. Please try to move your arm a little bit upwards and downwards and left and right. The hand is relaxed and hanging. Try again to float up your shoulder blade a little bit and sink it back down, or float up your shoulder blade and let it fall again. And now also turn the whole arm a little bit. Turn your entire arm around this axis so that your fingers are pointing more towards your face and more towards your feet. So you turn the whole arm and explore the directions. Explore where your arm can move and how that feels like. How you perceive gravity with your arm. The more you deviate from an ideal standing position, the more the pull of gravity will be noticeable. Easier to feel. Just play a little bit. You can play with your hands and your fingers. You can lift your shoulder blade and sink it down again. All these motions. And how they connect to the rest of your body. And then float down your elbow again. Float it down. Let it sink gently towards the floor until your arm is standing, and then sink down your hand on the floor until your arm is resting. That's nice, isn't it? And so your arm is on the floor again, lying next to you, like a friend. It's your ally. So in this series of lessons, we explored lifting the head, the opening of the chest in a flexion movement. Then in the last lesson, in the previous lesson, we did the shoulder movements, and now we extended this shoulder exploration down to the hand. We could go much further with the hand movements, but we will leave it with this. Next lesson, we will return back to our theme. Just one last time, the reference movement. One last time, stand your lower leg, your lower arm, your hand on top of your lower arm. And bring your fingers more towards the ceiling, and then sink your hand again. The movement we did in the very beginning of this lesson, and just feel how that compares. How smooth it is, how easy. What you feel in your fingers, in your wrist, in your arm, how aware you are of the different positions of your bones, of your breathing, that there's actually a connection between hand tension, hand movements, and the spine, and the face, and the jaw. I hope you had some revelations in this lesson. Now try to keep this delicate movement quality. We will end the lesson here. As always, in this world, we need to get up. We need to get up. So please, with this quality, come over aside to sit first. And take a moment to feel how you're sitting, how you're organized in sitting, how your right shoulder feels, your right arm compared to your left one. When you look to the left, you turn the head to the left and you turn the head to the right. If there is a difference. And then please come up to stand. Float yourself up to stand, just like we floated up the elbow. That's another story, isn't it? But try to float yourself up. Worked pretty well for me, I have to say. And here also feel your hand. Raise one arm, then raise the other arm and see the difference between the two arms. And turn your head to the left and turn your head to the right. See how that, if you perceive a difference. If you perceive a strong difference, you might need to do the lesson again on the other side, or just review. You can spend like 5 minutes. You can make it faster because you already experienced the thing on one side. You can transfer what you already learned to the other in some way. I think it's like handwriting. You can write with one hand, and on the other hand, it's not as difficult anymore because you already know how the letters are supposed to look like. You have just to figure out how to do it. There's lessons about this transfer, of course, but we'll leave it with this for today. I hope you had a good experience and some interesting insights. As always, please give the video a thumbs up if you deem it worthy. Leave a comment to share if you want. You can work with these thoughts from this lesson, with these movements, just a little bit. You can take a couple of days until you start the next lesson, however you want to. I don't give any suggestions for how, if you do it daily or if you have a week in between. That's entirely up to you. In any ways, I'm happy you have been here with me today, and I see you in the next video.